Good afternoon and welcome to the 2024 HeartCorps Service Member Celebration. I'm Nancy Brown, Chief Executive Officer of the American Heart Association, and it is my honor to help celebrate the amazing milestones you have achieved over this past year. For 100 years, the AHA has been a leader in heart disease and stroke research and care. By building awareness, removing barriers to health, and improving quality care in rural communities throughout our country, you are helping to ensure everyone lives a long and healthy life. As HeartCorps enters its third year as a public health AmeriCorps program, I'm excited to see the progress we have made across our 44 host states. Your dedicated service is making a direct impact on the health of your neighbors, friends, and families, and I can't wait to see what we will accomplish together in the years to come. I also want to thank our friends at the Leona M. and Harry B. Helmsley Charitable Trust and the Truist Charitable Fund. Their generous sponsorship of HeartCorps is helping to make this vital work possible, and we are so grateful for their support. On behalf of the entire American Heart Association, congratulations and thank you for being a relentless force for a world of longer, healthier lives.
Hello, and congratulations on the second successful year of HeartCorps implementation. This year has been even more exciting than the first, and I thank you for your work and for the wonderful year that we've had. The work of the AHA is so important to so many people, millions of people actually, patients, families, communities, and I realize that you have a choice to make in how you spend your life, and I'm so appreciative and grateful that you are choosing to work with the American Heart Association and to help us expand the important work that we do. Thank you. Appreciate you so much.
Thank you to Nancy Brown, CEO, and Suzie Upton of the AHA. Good afternoon, everyone. I'm Natalia Putnam, and I'm honored to be the MC for today's celebration. Thank you all for joining us today from across the country. Before we continue with our program, we're going to hear from two more of our fearless leaders. Please welcome Robyn Landry, Executive Vice President for Strategy Integration, and Jessica Donze Black, National Vice President for Community Health.
Good afternoon. I'm so excited to be a part of this celebration. I wish I could be with you today, but I'm on a flight as we speak. There are so many people on this call who are making a significant difference through our work in rural communities. We have our HeartCorps members, our clinical and community partners, and our AHA community impact staff. Together, you've made really important strides in rural areas across the nation. As the second year of our HeartCorps program comes to an end, we wanted to take a minute to thank our clinical and community site partners who host our members and allow us to advance the mission of the AHA. These host sites and your staff are a key part of our success in these communities. We'd also like to show our appreciation for the AHA Community Impact Directors who serve as field supervisors for HeartCorps members. Their work to coach and support members to make sustainable impact in communities is an integral part of our program's success. Finally, I appreciate the dedication and the passion of our HeartCorps members. I had the chance to meet and spend time with many of you at our scientific sessions in November and at a team meeting, and I learned so much about the great things we're doing across the HeartCorps communities. I was inspired by the way you're tailoring the work to meet the needs of your community while driving the AHA's impact priorities. Your service excellence has truly helped extend our mission into rural communities with a lens to meeting people where they are. Over 30 of our current members have asked to return for another service year with HeartCorps, another example of your dedication to this work. Whether it will be a second or third term for you, or if you're heading to school or to another opportunity, we thank you for honoring your service commitment and doing such a great job of representing the AHA. You are truly making a difference in the lives and health of the people who live in these rural communities across the nation. Thank you again for all that you do.
Well, hello, and I'm so excited that I'm getting to join you. I apologize. I am not dressed in my formal AHA attire. I am technically on vacation, but I did not want to miss this opportunity to say congratulations and thank you to so many amazing people, to all of our service members, to all of our community impact team members who helped to make this possible, to all of our host sites, to our HeartCorps staff, to Diamond and Kayla and Deshay and to Deanna on the brink of her retirement who brought all of us together. We're excited to welcome Catherine to the team, and to Toral, who works behind the curtain tirelessly to make sure everyone gets their reimbursement, if you're wondering how that magic happens, and to the entire community impact team, be it at national and local. But mostly, I'm super grateful that all of you chose to be HeartCorps members, that all of you chose to take this risk with us. I'm thrilled that I got to meet and get to know so many people when you came to Dallas this year, for those of you that had a chance to do that. Love the opportunity to get to know you sort of in our service opportunity, in our learning together. In some cases, learn that some of you can really sing, which is very exciting. I look forward to more of that. But wherever you may be in your journey next, be it continuing with us as a HeartCorps service member or on to other things in your communities, other communities, back to school, starting school, trying something new, please know that you're always going to be a part of our family. So we at AHA, although we are a place to work, we also really think of ourselves as a team and as a family, and wherever you may go, you still have us to connect back with. So please keep the contact information from all of your fellow members, other people you met on this journey, certainly all of us at National Center, myself included. Reach out if we can ever be helpful or just to let us know what's happening in your life. And feel free to come back. We talk often at AHA about boomerangs, who are people who work at AHA and then maybe do something else with their life and then end up working at AHA. And we invite everyone in our HeartCorps family to keep us in mind when the journey takes you someplace that may make sense for you to come back to AHA. So thank you for your incredible service. It's hard to believe. For some of you, it's been a year. For some of you, it's been shorter since you came into this experience. I hope you're taking away some valuable learning, some great experience, whether it be that you want to work in public health or healthcare, or whether you think, I'm really grateful other people work in public health and healthcare. All of that super valuable in lessons. So from the bottom of my heart, thank you. Thank you for being a part of our family, and please keep in touch as your journey takes you forward. And for those of you remaining, we look forward to continuing to work with you. Take care and be well.
Thank you, Robyn and Jessica. Jessica, thank you so much for making time for us while you're on vacation. We so appreciate all of your support. I think we can all agree that it's been a great year for HeartCorps and what we've been able to do to create equitable health opportunities in some of the country's most remote areas. Here to provide a brief overview of our achievements this year is HeartCorps Director Diamond Lassane.
Thanks so much, Natalia. And thank you to all of you for being a part of this special event to celebrate our HeartCorps members and the impact they've made, whether you're a service member, an AHA field supervisor, or one of our amazing host site partners. I'm excited to share with you some of the great ways we've made an impact in communities all across the country. HeartCorps, as Nancy mentioned, is now able to place members in 44 states. We look forward to achieving our goal to place at least 100 members in host sites, and we're growing. And so that's what's exciting. We have a number of new states that we'll be serving starting in September. It's awesome. Nancy mentioned some of our great funders who support this work. And to date, we've been able to connect with private and government partners who have helped facilitate over $16 million towards this life-saving work in our rural communities. Next slide, please. The big one, as of just last week, HeartCorps members have already dedicated almost 75,000 hours of service, direct service, and a little bit of training to the communities that they serve. We've had 86 members who passed through our doors this year, and just look at the impact that you all have made. Just under 18,000 people that you've been able to serve in your blood pressure control initiatives and in working to address nutrition security. And over 5,000 people that have been served in CPR demos or in being encouraged to pursue further CPR training to really address some of the critical needs in communities. And then smaller number, but no less significant, the work that you've done in tobacco cessation. We know that's a little bit of a different audience, sometimes working with young people in the school setting and the out of school setting, such as a Boys and Girls Club or a YMCA, but you all's efforts and outreach to educate community, to educate patients, to educate parents, to educate our youth have really made a profound impact. And I'll make a note right here and say, see why it's so important that we have those monthly reports? Can't get by without saying that. But we're so excited about the fantastic ways that you have served our community. A little bit about this experience. We've talked to you all as the service term comes to a close, but you all will be receiving in the mail, courtesy of our printorial, an actual certificate of achievement and completion of your service. This is just a demo. Of course, it'll have your name and my signature. Please, keep that in a safe place because it is a symbol of all that you've accomplished. We talk so often about the AmeriCorps Pledge, and it has a lot of really positive things there, but we also talk about sometimes the challenges that we face when we're truly looking to create sustainable change in communities. You may be faced with apathy, you've done events with low attendance, and you're trying to navigate that terrain to better understand communities and to better advance our mission. We're so grateful that you hung in there. We're so grateful to say that through your service excellence, many of you will be going back to school or on to school. A number of you will be returning to continue that great work. Some of you will be entering the workforce, either through your host site, even with the AHA. But whatever your next steps are, we're so incredibly grateful for your commitment to our HeartCorps program. It's been phenomenal. And we can't say thank you enough. And now let's get the show on the road.
Thank you, Diamond. That is amazing. Next, let's hear from 3 of our fellow service members who will each share a little bit about their service experiences. First up is Phaedra Handy, a 3-time returning member from the Southwest region. Phaedra.
Hello, everyone. I am Phaedra Handy, and I am going into my 3rd term, and I have been serving with the Boys and Girls Club of Jefferson County here in Pine Bluff. And when I first began with HeartCorps, I really didn't know exactly what I would be doing with the Boys and Girls Club. But once I got in there and got my feet wet, everyone was so supportive. I loved where I was as far as my whole site. I have a wonderful supervisor. I have a wonderful regional supervisor with Brady as well. And we've been able to do so much. We have, it's not just heart health. It's pretty much the whole child, not only just the child, but we have been able to help families in the whole region. We do things like hygiene. We learn about hygiene. We celebrate breast cancer awareness, community service projects. We work with the neighbor to neighbor locally. We've had food drives. We've had, of course, we do physical activity. My kids love that with the Boys and Girls Club. And I was also able to obtain a mini grant, and with the mini grant I did a wellness competition, which you will see there the picture of the wellness championships, the wellness champions, and we had a great turnout. Not just our kids, but our families were involved as well. We had a few parents, so we had not only the kids were involved, but the adults were involved and the staff were as well. So that was a great thing. Our kids learned about meal prepping, social emotional skills, how to be a friend, how to keep a friend. We learned, we love cooking. The kids love cooking. We even learned how to can. We learned how to do pickles, and we were donated a lot of bread from our local bakery. What do you do when you have extra bread that's a day old? You make bread pudding, and our children and our staff love the bread pudding as well. It's been great because there's a million places we could be. There are plenty of jobs that I qualify for as far as my education, my experience, that paid way more money, but those jobs were not working in my purpose. And I do it because I love it. I'm able to make a not only impact within my kids, but my community and my region as well. And it's really great. And this term, I was blessed to have 2 more people join with me in my efforts. So it's been great to have that wonderful support, as well as the support from my supervisor, Mr. Calhoun, and my wonderful regional supervisor, Mr. Brady, as well. So that has been great. We do great things like parades, and we won the number one first place in our Christmas parade on last year. So we're coming at them this year coming up. So I'll be happy to show everyone our first place prize again, because I'm very competitive. And as I always say, I want to be the change that I see. I want to be the change that I want to see. I'm going to be that change that I want to see in my community. And that's my spiel. And now I'm going to turn it over to Gabby from Midwest. Thank you.
Hi, everyone. As some of you know, especially my HeartCorps members, because I absolutely love to chat, my name is Gabby, and I'm based out of the Portage County Health District and University Hospitals Portage in Portage County, Ohio, and Northeast Ohio. I have absolutely adored and loved all the work that I do. I love to fill the cup of others, and I love to push to create change and promote health equity. Here I have a couple of photos of some of the work that I've done, but if we're being honest, it was really, really hard to fit 6 months of engagements into 2 slides of photos. First, I wanted to mention some work that I did with the amazing assistance of the mini grant we were offered at the beginning of this calendar year. I received funding to establish blood pressure hubs at 5 Portage County District Library locations, not only providing them with the blood pressure monitor itself, but also crucial information on how to lower your blood pressure and some booklets with connections to local PCPs and cardiovascular specialists. The data behind this idea actually came from the most recent Portage County CHIP that revealed that there was a need for more blood pressure education throughout the community, specifically the zip codes that include Windham and Ravenna, Ohio, which had the highest level of need. And now there are blood pressure hubs at both of those local libraries. This summer, I've also been really busy doing work at 2 local community centers summer programs. I visit each site weekly and lead kid-friendly education programs such as Exercise Bingo, Build Your Own Recipe coloring books, Heart Healthy Jeopardy, and have also taught hands-only CPR at those 2 locations. Another thing I've been incredibly proud of is my role in both of my host sites' implementation of nutrition and security programming. Specifically, the Portage County Health District, we have been able to set up a pop-up pantry at my host site with many community partners, which are listed on, let me see. Yeah, I believe that slide. So, sorry, let me adjust here. So this actually started in May and will continue beyond my time at my host site. And not only are families able to come through the pop-up pantry and get free foods, some of which are fresh fruits and veggies, especially around this time when a lot of farmers have extra fresh fruits and vegetables, they're able to donate to the Akron-Canton Regional Food Bank. And those fresh fruits and veggies are, along with plenty of other foods, are completely free of cost to them without proof of income. And they can also attend, we've set up almost like a mini health fair for the participation of local community partners that provide things such as blood pressure screenings, referrals to local health care, free bike helmets and car seat checks, and we're working on getting free hygiene products such as shampoo, conditioner, body wash, deodorant, and feminine products to be offered. Together, we have been continually increasing the amount of families that we serve from 119 in May, 137 in June, and 184 in July. Our next pop-up is actually this upcoming Thursday, August 1st, and we are hoping to reach 200 families this time. And of course, like anything, not everything has been all sunshine and rainbows. I have had the occasional event that hasn't really gotten quite as much traction as I would have liked. But in those scenarios, I really try to make the few interactions that I do get really matter and push for quality over quantity. And of course, I couldn't have done all of this work without the help of the HeartCorps team, as well as my amazing host site supervisors, and I cannot sing enough praise about them. HeartCorps has been by far the best job that I have ever had since I started working back in high school, and I am beyond excited to stay with a company that has quite literally has my whole heart, pun intended, as a community impact director for Northeast Ohio starting in August. So thank you. And now here's my friend Cameron Johnson from the Eastern States region.
Thank you, Gabby. Yeah, so I'm Cameron. I'll share with you a little today about my experience in HeartCorps. So I serve in a small community in southern West Virginia. It's my home community. It's called Williamson. I left here like 10 years ago to go to university, get a degree. I started a career actually in clinical setting. I didn't really love that much. So I decided to kind of delve away from that and move back to my hometown here of Williamson. And I wanted to find a way to continue to give back to people, but maybe not in that clinical setting. But I wasn't exactly sure what I would do. But one day I found this listing for HeartCorps and I checked that out, and I kind of knew right away, like, this is something that is going to fit perfect for my goals in life. So AmeriCorps, has presented me the chance to form relationships in my community that I think are actually making a difference. Being given the platform to engage the community in like a less formal setting than maybe they're used to seems to resonate well with most people. Speaking one-on-one with people about aspects of their health and like diving further into what some of that means, it's enabled me to connect with the community and build a sense of excitement about personal health. A lot of people in my community and the rest of Appalachia are sort of apprehensive about healthcare, whether that's due to bad experiences in the past or lack of access to treatment altogether. There's, like I said, sort of a distrust with the system as a whole. But this has kind of like a negative cascade effect for people. They have a lot of negative health outcomes because of untreated or unidentified health problems. And I feel like that's kind of where I've been able to step in. I'll tell you a quick story about a gentleman in my community. His name's Mr. Towns. He came out to my first blood pressure booth back in January. We had a nice conversation that day. He got his blood pressure checked. We talked about his diet. I discovered he was a diabetic. I discovered he had been kind of out of good diet habits for several years, so his numbers weren't that great. We spent probably an hour together that day speaking about those things and even some local basketball. He got super excited though to get back on track. And so about 2 weeks later, I had another blood pressure booth at my site and he showed back up. Again, he was super eager to show me all the progress he had made. And when we checked his blood pressure, it in fact had went down a few points. His blood sugar, according to him, was better than it had been in years. And this continued like week by week. He kept showing up around my host site, whether it was just to chat, about his health or his day, or whatever it was. But he slowly kind of started to inspire those around him. I noticed his personal community of friends and family that they started to come in as well to have their blood pressure taken or to speak about diet and ways they could improve that. Mr. Towns even, with my advice, started a little walking group within his living community, which I think is awesome. So not only was he able to inspire some people through words, but he took action and made a change. So I feel like moments with individuals can have more impact than we may realize, whether it's one person or 1,000. The outreach that we're doing really makes a difference. And the conversations that we have with people, they do impact them. So we all need to strive to continue to continue to help people make positive changes in their lives. But overall, I'm very grateful that I found this role. I've had the opportunity to contribute to my community, and I'm very excited to continue my role with HeartCorps for another term. With all that, I thank you all very much for all the work you do in your communities, and I'll pass it back over to Natalia.
Thank you so much, Cameron, Gabby, and Phaedra, for sharing your stories with us and for your commitment to our mission. Next, there are a few colleagues we'd like to recognize today, and I'd like to invite Kayla Knock, National Program Manager, to join us for this very special portion of the program. Kayla?
Thanks so much, Natalia. I'm so excited. I get the very exciting role of announcing 3 very special awards for recognizing all of our host sites and our field supervisors, as well as our members as well. So I thank you so much for letting me present these 3 wonderful awards. Really, these awards are about those that have gone above and beyond their commitment to their service and their compassion. So with that being said, I'd love to start off with our first award. This is the Host Site of the Year. The Host Site of the Year Award for HeartCorps really celebrates exceptional dedication and leadership amongst our partner organizations that host HeartCorps members. This award recognizes a host site that has demonstrated outstanding commitment to supporting the AHA and the HeartCorps program and the HeartCorps member themselves, while also improving cardiovascular health and promoting heart health within their community. The host site we're recognizing today has created a very supportive environment for the HeartCorps members by engaging in a collaborative relationship, implementing innovative activities, and sustaining efforts in raising heart health awareness and health equity. This year, the host site of the year goes to, drum roll, the Lumbee Tribe of Pembroke, North Carolina. Woohoo! Their dedication to HeartCorps really provides a nurturing environment for the HeartCorps member, Vanessa Locklear, who's on the call today, to really flourish. Implementing AHA activities with their HeartCorps member has made them profoundly impact the lives of the countless tribal members in Robeson County throughout southeastern North Carolina. This award acknowledges the exceptional leadership and dedication to promoting nutrition security, educating the community about cardiovascular disease, and preventive strategies, while fostering a community readiness plan through our Heart Savers initiative. Thank you so much to Tammy Maynor, for all your support for the HeartCorps program. Please, in the chat, please send your congratulations and your excitement. We want to hear it. All right, with that, we've got our next award that we are excited to present today. This is the Field Supervisor of the Year Award. The Field Supervisor of the Year Award is more than just a recognition. It's a celebration of excellence in leadership. It represents the pinnacle achievement of field staff, highlighting those who have not only inspired their members, but also embody the values and mission of HeartCorps in everyday action that they take. Our HeartCorps Field Supervisor of the Year is, let's do another drum roll, get all excited, Sam Gardner. We're so excited. She really exemplifies unwavering dedication and profound impact across the state of Wyoming. Sam's commitment to her service is unparalleled. She's consistently going above and beyond to ensure the well-being and success of her members. Her leadership has not only transformed the lives of those she manages, but also has resonated throughout the entire program. Sam's leadership and her unwavering support and mentorship for her members has set really new high standards of excellence that embody what HeartCorps is really supposed to be about. Aiden, Caitlin, Eva, Casey, Kayla, they're all very lucky to have you as a supervisor. So Sam, congratulations. Please join me in the chat with giving your congrats to Sam. All right, now we've got the privilege of talking about the Member of the Year. So this is an award that we have titled the Robyn Landry Robyn Landry Excellence Award. Robyn Landry, you heard her a little bit earlier, is the Executive Vice President of Strategy and Integration at the American Heart Association, and she has 35 years of dedication and leadership to our mission at the American Heart Association. And we decided to name this award after her because it recognizes those who embody an unwavering passion and tireless effort to making the profound difference in communities across the country. So without further ado, we are honored to present the first Robyn Landry Excellence Award to, drumroll, Emily Sesser. We are so excited to offer you this award. You've done such a great job, not only within your field, but you always volunteer for leadership roles when other big events are happening, like when we did HeartCorps retreat back in April. So you've done exceptional work. We're so excited that you've been a member with us and you have great HeartCorps spirit, and really set the level for what a HeartCorps member can do in this role. So congratulations, Emily. Please put all your congratulations, your heart emojis, lots of positive energy into the chat. So excited to have you. So with that, I would like to transition it back to Diamond, and she will refer to some closing remarks. Thanks so much.
Thank you, Kayla. Let's give it up in the chat one more time to our 3 award winners, the Lumbee Tribe of North Carolina, our illustrious colleague, Sam Gardner, and to our celebrated HeartCorps member, Emily Sesser, who is also joining us and seeks to return for another term of service. Thank you all for your service excellence. I have the extreme privilege of closing us out for the day. And on behalf of the HeartCorps team, as well as the entire American Heart Association, thank you all for joining us today. Before we go, we also want to take this time to acknowledge one of our esteemed colleagues who will be heading off to an exciting new adventure in the land of retirement. Deanna Lyons, who's our current HR business partner for HeartCorps for about 6 more days, is retiring after a really vaunted career at the American Heart Association. And while we're sad to see her go, it would be remiss of us if we didn't take this time to acknowledge her work, her commitment, her dedication, and her passion and care for our HeartCorps members and the broader HeartCorps program. Deanna has been such an instrumental factor in helping us to actually stand up this initiative, which was a new venture for the American Heart Association, with her own heart for service and for community, as evidenced by her own son being an AmeriCorps alum. Deanna entered into this new role with great fervor and energy, lots and lots of organization. I've never seen as many spreadsheets, and an incredible emphasis on doing what's right and what's most right for our members in our program. We would like to thank Deanna for her tireless commitment to our program as she helped to build its infrastructure. So on behalf of us all, thank you so much, Deanna. I know we surprised you with this, but it would be remiss of us if we didn't acknowledge how much you have come to mean to us as a program, as a staff, and to each of us, I think, individually. But she's not leaving us empty-handed. Excited to share that Catherine Halverson is now transitioning into the role that Deanna has vacated. And so we're excited to welcome Catherine and to work with her more closely. But we've stayed really true to our agenda. And so we want to thank you all over these next few weeks. Many of you will begin to wrap up your service experience. And so we wanted to make sure that we gathered together before you guys went on to the next biggest and greatest part of your lives to honor and acknowledge your service commitment. As an AmeriCorps alum myself, I know exactly the challenges as well as the opportunities that a service experience can provide. And we're incredibly grateful that you chose us as the vehicle for how you engaged and supported community. All right, one last time in the chat. Congratulations, everyone. Take care and have a fantastic weekend. Goodbye.